Hello everyone, I'm Dr. Gursimran Kaur, Senior Consultant, Obstetrician and Gynecologist at Fortis Hospital, Ludhiana. Today we will be talking about cervical cancer. But why? Very important, pertinent to these times is the awareness about cervical cancer and preventing it. Cervical cancer is the second most common cancer in women in India after breast cancer. And globally, the death rates of this cervical cancer are just 7 per lakh. In India, it is going above the global average. That's 11.7 per lakh according to the figures. So it is very important to talk about cervical cancer. But what is cervical cancer exactly? Let me show you. So cervical cancer, as you can see in this model, this is the uterus and this is the cervix. This is actually the neck of the womb, or it is actually the mouth of the uterus, which is called the cervix. And any tumor or cancer which is arising from that part of the part which is the cervix is called cervical cancer, which you can see in this diagram. You can see this is the cervix and this is the cervical cancer. So cervical cancer is a problem which we have to deal with, and so many women are still not aware about cervical cancer. This early signs and symptoms of cervical cancer are many. So what are they? I'll be talking about the important symptom. A woman can complain of bleeding after intercourse. She can tell that she is having an abnormal bleeding in between menses, or sometimes she can have a foul smelling discharge from the vagina, or sometimes she can have discharge which is pinkish white in color, or there's pain during intercourse, or there's pelvic pressure, or there's blood in the urine, or there's blood in the stool, or there is lump, or there is feeling of pressure in the abdomen, or backache, severe backaches. These are very important symptoms of cervical cancer. And if you are having any of these symptoms, you must talk to your doctor about these symptoms and she will check you accordingly. So, who are the ones who are at risk of cervical cancer? Very important nowadays is the talk about HPV, that is a human papilloma virus. So this HPV virus is incriminated in 90% of the cervical cancers, around 70% of the vulvovaginal cancers, and 60% of the anal cancers. So it is very important we know about HPV, which I'll be talking about later. Another thing is women who are starting to have intercourse at a very early age, less than 18, or who are having a multiple sexual partners, or who are smoking, or chronically having any kind of a drug abuse, or they are having alcohol, or these women who are obese, or they are not having exercise, they are not having good food, or women who are taking oral contraceptive pills, that is the birth control pills, for more than 5 years, they are all at risk of cervical cancer. Women who are immunocompromised, who are having HIV or diabetes, also can give you a risk factor for contracting cervical cancer. So we will be talking about the human papilloma virus. So HPV is the virus which causes the cervical cancer. Now I'll show you in a diagram how the HPV is contracted. So what happens is, this you can see is the layer of the cervix. So what happens is the HPV virus, through the sexual route, through the sexual intercourse, it enters into the vagina, it goes and infects the cervical cells. So if your immunity is strong, or you have been vaccinated with cervical cancer vaccine, you will be able to fight it out. You will be able, the body will be able to ward off the HPV infection. But if you are immunocompromised, or there are other risk factors which I talked about, then this virus will multiply in your cells. It will change the DNA of the cell, and the cells will start becoming abnormal, but it is a slow going cancer. So the cells you can see, these are the normal cells, they will become abnormal, and then it will all become abnormal till the time it spreads out through the whole layers of the cervix. What we are doing in the testing for cervical cancer is a very important test, is a screening test, is the cervical smear test, which is called the pap smear test. Many women have in their mind ki doctor, why we are having the pap smear test. So the pap smear test is done to detect the precancerous states of the cervix. We are actually picking you up at the level where you have not certainly developed cancer. You may develop cancer maybe 3 years later, maybe 5 years later, we don't know, but there is a risk, and we if we find that there is a risk of cervical cancer, then we go for the treatment so that a woman may be saved of the cervical cancer. Unfortunately, many women in India, especially in the rural population, they are not aware of this test. Many of the women have in their mind it's a painful test. Not at all. It's not painful. It can be just done in 5 minutes. What it is actually a screening procedure to test for the cells which are abnormal in the cervix. So we are testing for the precancerous or the cancerous cells in the cervix. We are looking for infections. We are also testing the DNA of the HPV. We are looking for the HPV DNA test. So how it is done? It's actually, this you can see is the cervix. So your gynecologist will internally examine you, and after examining, she will insert this brush. You can see this brush, and this brush will be inserted into the vagina, into the cervix, and she'll move this brush, and the cells will be transferred onto this brush. So when the cells are transferred into this brush, this will be put in this liquid pap smear, liquid bottle, and this bottle will be sent to the lab. So once this bottle is sent to the lab, there will be testing of the cells of the cervix onto the microscope, and then the pathologist read out whether these cells are abnormal, whether they are normal cells, or whether they are precancerous, or there are cancerous cells. So accordingly, we will guide you about your factor, the risk factor of contracting your cervical cancer. In Canada, by doing this simple test of pap smear, they have reduced their cancer incidence of cervical cancer from 40% to 13%. So this test is so much important. Even WHO says that we should be able to achieve the screening of at least 70% of our women under the age of 35 with cervical cancer pap smear test. So this is a very important test, and a woman should keep a reminder, like you keep a reminder for your birthdays, for your anniversaries. You should always keep a reminder for this pap smear test. Now, many of the times women ask me at what age we should begin the pap smear test. So this test should begin by the age of 21, and by the age of 21 to 29, we are doing this pap smear test every 3 years. And then if you are between 30 to 65 age group, then you can do this pap smear, dequy pap smear test, that is done every 3 years. But if you're doing a co-testing, that means your gynecologist is also testing for pap smear abnormal cells, and she's also testing for HPV DNA, then this test can be repeated every 5 years if you're doing a co-testing. So why we are testing for HPV DNA? Because there are certain human papilloma virus, there are 200 different types of HPV viruses, in which 40 viruses has been shown to cause these penile cancers, anal warts, genital cancers, and out of which there are certain strains which are more oncogenic, which are more carcinogenic, and out of which we have developed vaccines against HPV 16, 18, 35, 45, and these are the few strains against which have been found in 90% of the cancers. So the vaccines have been developed against these. So if a woman has a HPV 16 and a 18 HPV DNA, then she needs more regular monitoring, and we are able to find out the risk factor earlier before she actually contracts the cervical cancer. And this cancer, it's a slow growing cancer, so it will take many years or many months to actually go from one stage to other stage. So we have a stage 0, that's the precancerous stage. Then we have stage 1 where the cervix, it is in the cervix, and then stage 2 where it is spread to the contiguous organs like the uterus, the vagina, and it has not still gone out of the pelvis. In stage 3, it has gone outside your lower abdomen, that's the pelvis, and in stage 4 it has gone to other organs also like liver, heart, brain, lungs, and it has metastasized. So if you are able to detect the cervical cancer in stage 0, it's curable. If you are still detecting it stage 1 or stage 2, it is still the 5-year survival rate of the woman is 91%, as compared to the 5-year survival rate when you detect it in stage 3 or 4, when the cervical cancer, the prognosis or 5-year survival rate is just 60%. So, the whole idea is to pick up the woman when they are in stage 0. Suppose a woman gets a precancerous lesion and she is above 45, and the cervix tumor has been removed by doing a hysterectomy. Then she doesn't have she has 0% to contract cancer now. She is cured of the cancer. But even if you're able to pick up at stage 1 and stage 2, you can still do surgery, and after that you can do chemo radiation to this woman. So there are many treatment options which are available to these women, but best remains is that you pick them early, diagnose them early, and treat them early, so that the 5-year prognosis rates is much better. How do we prevent girls or women from cervical cancer? First thing is diet. Tell them to have a healthy diet. There have been a lot of research into the diet taken to prevent cervical cancer, out of which apples, asparagus, Brussels, then you have beans and broccoli and cabbage, and then you have things like the ginger and garlic. These are the foods, if you incorporate in your diet, then the less chances of cervical cancer. Practicing safer sex, and having to treat vaginal discharges. If you're having a vaginal discharge, tell your doctor to treat it properly so that you don't have the risk of cervical cancer. And also, two main important strategies world over is pap smear, which I talked about earlier, and there's another which is a very potent vaccine, which is HPV vaccine. So many of the times I've been asked, Doctor, what is the HPV vaccine? What is human papilloma virus vaccine? So it's a vaccine which is prepared from the protein of the HPV DNA, which is the L1 protein. And this protein is then producing that immunity in your body, which will help you fight the HPV infection. Suppose you have a sexual intercourse with a person who have been infected with HPV, and you get a HPV infection from that person, maybe it's your partner, maybe your husband, your spouse, or anybody, and if you have got a cervical cancer vaccine done for yourself, then the chances of you contracting that HPV infection goes down, because you have the immunity to fight that infection. So, what are the cervical cancer vaccines available in India? They are the bivalent vaccine, which comes by the name of Cervarix, which is against HPV 16 and 18. Then you have Gardasil 4, which comes, it is protecting you against from 4 viruses, that is HPV 6, 11, 16 and 18. And then you have the new vaccine, which is Gardasil 9, which is protecting you from the 9 virus strains of the HPV. How much potent this is? It is actually, the research stage, from 98 to 100%, these vaccines are protecting you from cervical cancer. What's the age we start with the vaccination? As early as 9 years. Yes, you heard it right. 9 years is the age when you tell these young girls in the school to get yourself vaccinated. It's a safe vaccine, and you can start from the recommendation is between 9 to 26 years age is the best age, but you can still give it till the age of 45. What's the scheduling? Between 9 to 14 years of age, you have to give at least 2 doses of the vaccine, and from above 15 years of age, you have to give 3 doses of the vaccine. If it is a bivalent vaccine and if you're giving 3 doses, it will be 0, 1 and 6 months. And if it is a quadrivalent or the other vaccine, then it will be 0 and then 2 months and then 6 months. How is the jab taken? In the deltoid, in the arm. One vaccine, it will go intramuscular, that can be taken into this vaccine. So minor side effects like joint pain, swelling, muscle fatigue or fever, but there are no as such incidences reported worldwide over with major side effects. It's a very, very safe vaccine, also been incorporated in many vaccination schedules all over the world. So it is a prime responsibility of the healthcare providers to make aware not only our girls but also the parents of the girls about this vaccine which is available. And by giving this vaccine, you can protect so many girls in the early age group from actually having any HPV infection or any cancers which are related to the HPV infection. But still, even if you have been vaccinated, still you cannot miss with your pap smear test. That is very, very, very essential, because you may be vaccinated with 4 viruses or against 9 viruses, but there's still other 40 types of viruses which may be attacking you from somewhere else, other origins. So it is very important by pap smear test, which can actually protect the woman by giving them inside view of the cervix. By knowing the cervical health, they can be actually protected in the precancerous stage of the cervical cancer, and which is actually a stage which is curable. Once you take out her uterus outside the body, if she has been infected with precancerous conditions, then that woman is gonna live cancer free. So that's the whole idea of getting the pap smear done. Thank you all for watching Health Plus.